Good evening. I'm Denise Webber, Stillwater Medical CEO, and I'm honored to be joined here tonight with Larry Reece, Oklahoma State voice of the Cowboys and Cowgirls. And I just love that video, Larry. That really depicts just all that our team has been through. And it reminds me about, it's been a tough 8 months, but most importantly, we've had a community that's rallied behind us, and so many of our supporters and donors have reached out, dropped off gifts, and all of that impact has been tremendous on our team. It's humbled our team, it's inspired our caregivers to continue to sacrifice all that they do taking care of our patients, and it's engaged our community. And so, just a sincere thank you to all of our supporters and donors for all that you do. And thank you for being here tonight. You know, when I'm out and about, which isn't very often right now, but when I am, I always ask about what's going on, what really is happening behind the doors of Stillwater Medical. And so I thought it would be nice for our donors and our supporters to have peel back the cover on what's going on at Stillwater Medical.
Well, and I'm honored to be here with a longtime friend and one of our leaders in the Stillwater community. I appreciate everything you do. So let's do this Q&A and get some information out there. So let's talk about capacity. Oklahoma is one of many states struggling to try to control this pandemic and the spread of COVID-19. So tell us how Stillwater Medical is currently handling, the issues of hospital bed capacity, access to quality staff as well as protective gear. There's so many moving parts.
So many moving parts. And yes, right now, when the pandemic began, protective gear was kind of our main priority back in March. And it got really scary. Thankfully, we're doing great on protective gear right now. We're able to source it and keep our supply up and provide all the protective gear needed to our team. Beds capacity, that's becoming a challenge for us. We added quite a few beds just in anticipation of a surge of patients. And so right now that's happening on a daily basis. We're seeing more and more people present to our ER needing COVID treatment. And we've been at ICU capacity for COVID on pretty much a regular basis for at least the past couple weeks. Same thing with medical beds. We're starting to have patients in a status, what we call ED hold, emergency room hold. And so because we won't have a bed available and we can't find a bed throughout the state, they'll stay in the emergency room area until a bed opens up. The biggest challenge, though, has been staffing. You can't grow a doctor or a nurse or a tech on a tree. And so trying to make sure that we have the adequate staff to take care of people is just a challenge.
Speaking of staff, how is the medical team coping? Like you said, it's been 8 months and it's been stressful for all of us, but especially those on the front line.
Especially those on the front line. It's a daily challenge. And sometimes moment by moment, I was talking with one of our hospitalists yesterday, and he was remarking about how hard it is when somebody's struggling to fight for their life with COVID, and their family member may have been the one accidentally, unintentionally that passed it to him. Just the guilt, and there's so much pressure on the healthcare team to do all they can to save those lives. And so we try to, we look out for each other. I just reminded our team of that 2 days ago to say, some of us just by nature go, go, go and don't take breaks. And you've got to kind of step away, recharge, and so you can get back at it.
When it comes to supplementing your staff, I mean, it's not like we're not surrounded by other states that are struggling with the same pandemic. So what options do you have in the state, and, in the region to supplement your staff? And along those same lines, I mean, are you working with other area hospitals to expand staff and capacity?
So this round, the first surge in the nation, it was very isolated to a few states. And so we had people from Oklahoma going to other states to help support those other states. And this go around, the whole nation's kind of surging. And so there's not a lot of what we would call cavalry to come in and back us up. So we're coming to grips that it's on us. Now I would say more than ever before in my career, I am a text message or a phone call away from so many other CEOs throughout our state. We've created text groups and collaboratives. And so we do work together to try to share and come up with resources. We work with staffing agencies, just anywhere that we can we can find staff.
Big news is the vaccines are coming online. When and it is plural, it's vaccines. That is the good news. It's going to create issues because there's going to be different ways to get that out there and different ways that it is accessed. So, talk to us about what you see coming, and the word is that the frontline workers will be the first. So, are you queuing up your team for that?
We are. Yes, that is great news. That's a little bit of light at the end of the tunnel. And if we can just continue to take the precautions that have been advised to us from the CDC to get to this point with the vaccine, I think we'll get over this hump. But yes, our front line, those people that are taking care of COVID patients, that's the first phase. And so we're sending out a survey monkey to our team soon to see who, because it's not something that people have to take. So to get a good idea on who's going to be willing to take this vaccine. And the second round is all healthcare workers and first responders. And then there's a couple other phases. And we're hearing through the health department is that it'll get to the general population probably in the spring, maybe early spring of 2021. It's going to take some doing to get that distributed.
It's also flu season on top of everything. So it's usually a stressful time anyway on your staff. How much more stress does that put on the Stillwater Medical Center family?
So luckily right now, and I think it's the mask, I know a lot of people are wearing masks. And so we are seeing flu, and flu on top of COVID is not a fun thing, but this is not an intense flu season so far. So we're very thankful for that.
Absolutely. So what advice can you give others? We talked about the stress of this on first responders, but everybody's stressed. So what advice can you give to all of us that are listening right now?
I'd say be careful about making sure the information that you're getting on COVID-19 is somewhat factual, because if anybody tells you they know all the ins and outs about this, I mean, we're watching the whole state, the whole nation, the whole world learn and go through the scientific method in front of everybody. And so I would say that, there's a lot of stuff out there about, do masks work, not work. And, I like to equate masks to some sunscreen. It's inconvenient, but if you're out in the sun, you put on some sunscreen, you avoid a sunburn. And so none of us like masks, but they're way more, I like people. I like all the people I'm around way more than I dislike wearing masks. And so I hope my advice to people would be, please wear your mask and take all your precautions. And I'm very hopeful for this vaccine that'll get us over the hump, if you will.
Mm-hmm.
And there's a lot of great information out there on the CDC website. It's a lot, but it can give you a lot of good information on what to do.
Well, I just treat it as an accessory. I mean,
Exactly.
Look at that. And I actually look better in a mask.
Yeah.
I've had people tell me that. So keep that in mind.
They're kind of getting fun. I see all sorts of...
Let's just make the most and have fun with it.
Exactly.
So we're here for the surgical expansion. So one last question, just real quickly, as we run out of time for this Q&A, is have you had to cancel elective surgeries? How much of that has been true? How much has been false? Have you had to scale back?
I've got to say that I've used the term elective surgery in my line of work for years, and we've got to rename that. It is not elective surgery. There are elective surgeries in the world. You don't necessarily have to have a cosmetic surgery, and sometimes your eyesight might be okay, but you'd like it a little better. There are some surgeries that are somewhat cosmetic, but what Stillwater Medical Center does is not really elective. Somebody has an ailment and it's causing their life to not be what their life could be as far as a health standard. And so we have had to cancel some elective surgeries to try to create capacity. And we have a team of physicians that really analyzes, because they're not elective, to make sure we're not canceling anything that's going to cause harm. But that is something that we do on a case-by-case basis, on a daily basis. But yeah.
Denise, thank you for all that you do, and the entire Stillwater Medical Center family. Thank you all so much. I just want to say on a personal note, the Stillwater Medical Center family helped me get the diagnosis. We knew I had cancer. We didn't know where it was. We found it as throat cancer, and it really helped save my life. And I so appreciate that. But also, you took great care of my parents in their late stages of life as they struggled and their health deteriorated. And I, for one, know how blessed we really are in this community to have a health center like this. And just thank you for all that you do. And along those lines, we want to show you another impactful video that will speak further about the impact of Stillwater Medical Center.